Hi everyone, Coby here at osteopath@soothclinic.com. Just going to bring up my live chat in case anyone feels like talking to me. Hello, welcome, thank you for joining me. I hope you're really well. And so today we are going to be answering your questions about sciatica, the very elusive, very horrible condition that is sciatica. So first of all, if you're joining me now, you have my condolences because sciatica is horrible and you probably don't get much sympathy from anyone for sciatica. They just kind of, unless you've had sciatica, it's really hard to understand quite what interruption to your life it is and how much it affects you. And if you don't have a diagnosis for your sciatica, it can be really kind of almost affect you mentally as well, because if you don't know what's causing you sciatica, you don't know what to do about it to resolve it, so anything you do doesn't work, and anything you do that does work probably doesn't work for long, and then it kind of comes back. So let's see if we can help you guys a little bit. So the most important point that what I hope to achieve with this little live video is to give you a complete understanding of what sciatica is and give you a little bit of a clarity about how you are going, what steps you're going to take to resolve it. Because the majority of sciatica, there are some conditions that cause sciatica that are quite kind of hard to get rid of. But I would say 90% of sciatica is completely unnecessary. And I've had patients who've had sciatica for years, literally years, and we've shifted it like really fast just through getting a clear diagnosis and a clear kind of set of actions to take. So let's start with what is sciatica. So I thought I might start this by showing you a little picture of the sciatic nerve. Here we go. So it's the biggest nerve in the body, and it passes from the L4 and L5 lumbar vertebrae, and the top three sacral nerves as well. So if I show you the nerve roots, it passes from, I don't know if you can see my cursor here, but from the bottom here. And all these little nerves converge into one great big fat nerve. And this nerve passes all the way down the back of the thigh, back of the knee, and either side of the foot. Let me bring you back so you can see me. Hello there. So the thing about sciatica is you can feel it anywhere along the pain, anywhere along that nerve. You can feel it in the back of the thigh, you can feel it in the buttock, you can feel it in the back of the knee, and you can also feel it either side of the calf. So one of my questions that has been asked today is, I have pain. Where's my questions gone? I've summarized, I've made them really small so that I don't have to spend a long time reading them. So I have pain in my calf. Is this sciatica? So if you've just looked at that picture there, you can see, yes, absolutely, pain in your calf, let me bring that nerve back, is absolutely sciatic, because the sciatic nerve does pass down either side of the calf and down the back of the calf. Often the first sign of sciatica is pain in the foot. Oh, there we go. I've had so many technical problems today, so do forgive me. So yes, so that is sciatica. So pressure on any point down that entire nerve will give you sciatic pain in the leg. So the thing and the main point I want you to go away with today is that sciatica is not in itself a condition, and this is the biggest mistake that people make. It's amazing how many people contact me saying, I have sciatica, what shall I do? But that means nothing. I have sciatica means nothing other than that you have pain. It doesn't tell me or anyone why. So number one is, why do you have sciatica? What is pressing on that nerve? And which part of the nerve is it pressing on it? Is it pressing on it right at the root? If I show you a little picture of this, you might understand this a little bit more. This is your vertebrae. This is the bones in your spine. And the yellow things you see here are the nerves as they pass out of the vertebrae, out through what we call the foramina. And these little pink things here, they're your discs, intervertebral discs. And then we've got your bones here. So one of the things that can happen that causes sciatica is you can get a little bit of degeneration here at this point in the foramina, a little bit of what we call osteoarthritis, where you just get a really normal kind of level of wear and tear, but that can cause a little bit of pinching on the nerves. Another thing that can happen is the discs themselves, these little pink things here, these little pink donuts, they can start to wear down and degenerate, and then cause two things, a little bit of inflammation. They secrete some chemicals, inflammatory chemicals, and that can irritate the nerve. And also they actually, as if a disc bulges, it directly presses on a nerve as well. And it can press on any level, so it might press on L4 nerve, it might press on L5 nerve, and you will experience pain in different parts of the leg depending on which part of the nerve is being pressed. So, where are we? So there's lots of things you can do. So another thing that causes sciatica is tight bum muscles. It's what we call piriformis syndrome. So people who sit a lot, people who cycle a lot, people who ride horses or go to the gym a lot don't realise that they are gently, slowly building up tension in the piriformis muscle. I'm just going to show you a picture of the piriformis muscle. There you go, it's that little red one right at the top there. The sciatic nerve passes out of the vertebrae and then directly underneath the piriformis muscle. And so if the piriformis muscle becomes very tight, it can put pressure onto that sciatic nerve. In 5% of the population, the sciatic nerve, this pink one here, actually passes directly through the piriformis muscle. So that can be very painful. So there we are. They're the main causes, in my experience, of sciatica. So we've got a little bit of wear and tear in the spine, which we call spondylosis or osteoarthritis. We have a disc degeneration, putting a little bit of pressure and inflammatory chemicals around the sciatic nerve. And then we have a bulging disc pressing on it. We have tight bum muscles, piriformis syndrome. So depending on what is causing your sciatica will affect what you should do about it. So if your sciatica is being caused by spondylosis or osteoarthritis of the spine, that's where you're getting like a compression, then there are exercises that you can do to actually gap the spine and gap those foramina and open them up. Takes pressure off the nerve, just gives the nerve a little bit of space to breathe and a space to move, and can actually cause instant relief. It won't cause permanent relief because you've got that underlying wear and tear. But then, very controversial, but I do believe in supplementing with glucosamine sulfate, because glucosamine sulfate has been shown on X-ray to rebuild cartilage. So I think it's good for degenerated discs. And and obviously going on a kind of an alkaline diet to reduce all the inflammation in the area. So if you're getting this inflammatory response from the disc with degeneration of the disc, going on an alkalizing diet will help to minimize that inflammation. If you have piriformis syndrome or tight bum muscles, then there are absolutely loads of exercises you can do to stretch out that piriformis muscle. And also the good old elbow is absolutely fantastic for sorting out piriformis syndrome. My elbow was famous when I had my clinic in Manchester. People would walk in and say, I've heard about your elbow, I don't want it anywhere near my piriformis. But the pain relief can be extraordinary. If a tight piriformis is causing your sciatic nerve pain, then it's very quick to resolve if you can stretch out and get some deep pressure directly onto that muscle. In my experience, the majority of you watching this will have piriformis syndrome, tight muscles. It's such a common cause of sciatica, and it's so easy to resolve. It's painful how many people experience high level of pain with sciatica because of piriformis syndrome. So what can you do about that? Another thing that's great for piriformis syndrome is hot and cold packing directly over the gluteals. And also acupuncture is really good, directly into those muscles. I really do believe in acupuncture, or even just what I practice, which is dry needling, which is, osteopaths, physios, chiros, we can do literally like a 2-day course, because we're already highly trained in anatomy and treatment of the body. And then we're just trained to insert needles into what we call trigger points, which are just areas of spasm within muscles. And that kind of activates a massive relaxation response through the muscles and brings a lot of relief from pain that is being caused by tight muscles. So that's a great one. So dry needling. So if you are seeing a physio or a chiropractor or an osteopath for your sciatica, do ask them if they practice dry needling, and give it a try. Can bring very fast relief. So hot and cold packing, hydrotherapy, which I do suggest a lot for any kind of muscular aches and pains, is that the alternation of heat and cold onto a muscle can have a very powerful relaxation response, because in the heat your blood vessels expand to allow the heat to leave, and in the cold they tighten up. And if you do that alternately, you're getting a contraction and expansion of your blood vessels, that smooth muscle, and that magically instigates a relaxation through the muscle. So very effective there. Obviously yoga, if you have a disc bulge, the right exercises can be very effective at kind of repositioning that disc. You want to take that disc off the nerve. So the key to resolving sciatica really is in identifying at what level of the sciatic nerve is it being pressed or irritated, what is pressing or irritating it, and that's your starting point. If you don't have that yet, if you don't have a diagnosis, it's just a simple diagnosis, you don't stand a chance of getting rid of your sciatica. The minute you have a diagnosis, you can ask any medical professional advice, and you can start getting some resolution there. So there we are. So I've looked at what is sciatica, what's the sciatic nerve, what causes it, what's the resolution. So let's move on to your questions. So just got a couple here. I was expecting to be inundated with questions about sciatica, and I wasn't. I mean, I've had 3 questions in. I was expecting quite a lot more than that. So I'm hoping that that's because the majority of you do have a diagnosis and you do know what's causing it, and which is really good. I'm really happy about that. That's great news. So I've answered the first one. I have pain in my calf. Is this sciatica? Yes. Okay, here's another one. I've really reduced this down because it was an essay. But I have spondylosis, which is, as we've just discussed, it's kind of wear and tear through the spine and through the facets, which cause pressure on those nerves. I also have a disc bulge, 2 disc bulges, 3 and 4. Should I treat my spondylosis first, or should I treat my disc bulge first? That's actually a difficult one, because the treatment for spondylosis is quite different to treatment for a disc bulge, because to treat spondylosis, I would suggest knee hugs to open up the vertebrae and decompress the nerve. And for a disc bulge, presuming it's a posterior disc bulge, I would recommend back bends to reposition that disc. So to answer your question, spondylosis is what we call a chronic condition. So it's taken you many years to get that situation, and it's going to be a long-term plan to treat and manage spondylosis. Whereas a disc bulge is more of an acute condition. So I would say you're going to have to treat the disc bulge first. So you need to start doing, minimizing sitting to take the pressure off the disc, and start doing those back bends, those lovely cobras. And so you need to get that disc back into position and then treat the spondylosis when the disc is kind of strong enough to be able to allow you to do those knee hugs to gap the back of the joints there. Right, I hope that answers it. But I would suggest that you do this under the guidance of a manual therapist, so that you're really staging it. Okay, last question. I have been offered an operation for my leg pain. due to a disc bulge. Should I take it? So my answer to this is, well, if you've been offered an operation for a disc bulge, I would suggest that you do take it, because they're not offered very often. They're very expensive, and obviously any operation, you're taking a risk. And in my experience, I've had patients beg for an operation from their GP and not be offered one, because the majority of disc bulges move back into position completely by themselves, and you get complete pain resolution. So if you've been offered an operation, that indicates that you most likely have perhaps a prolapse. So it actually really needs an operation, or it needs correction. Basically, it's not offered easily. So if it's been offered, I'd possibly consider it. So there we are, short and sweet this week, my friends. Just wanted to really give you some top tips and clarity about what sciatica is, and clarity about how important it is to have a diagnosis, and clarity about how easy sciatica is to resolve once you have a diagnosis, and also just to let you know that the majority of you have just tight bum muscles, tight piriformis, and you can get rid of your pain within a few days, and I really mean that. I'm not making that up, I'm not over-exaggerating. Chronic sciatica of many, many years can be shifted, if it's caused by piriformis syndrome, can be shifted very fast with the right treatment and the right exercises. So I hope that was helpful, and have a great day, and get in touch with me. I will be doing another YouTube Live next week. Haven't decided what subject yet, but email me, koby@soothclinic.com, if you have a suggestion for what you'd like me to answer questions on. All right, my friends, take care and have a great evening.